Good morning, everyone, to the fourth annual edition of the Interdisciplinary Workshop in Development Studies, ISDS, organized by the Center for New Economic Studies and OP Jindal Global University. This workshop brings together scholars, domain experts, journalists, and social activists to deliberate on some of the most pressing developmental issues of our time in a workshop format panel discussion. Previous ISDS workshops organized by the center have focused on themes such as role of gender in economic development, urban transformation, a transnational perspective, acclimatized emergencies, amongst others. The workshops have featured experts and scholars from esteemed institutions such as the SOAS, UCL, the London School of Economics, Jawaharlal Nehru University, Delhi School of Economics, and social organizations such as Radar, India, Begum, and the Soche Foundation. The 2021 edition of ISDS Workshop will introduce the Access Inequality Index, AEI, which measures inequality across states and union territories in India, followed by panel discussions on various themes in the index. The index aims to provide an in-depth assessment of each Indian state's performance in ensuring access to basic social and economic services. The workshop consists of 3 panel discussions. The first panel discussion, titled Access to Inequality in India, an analytical study for states across India, will introduce and reflect on the report published and have a look at the performance of states based on different paradigms. The second panel, titled Frontiers of Digitalization, Possibilities and Limitations from an Access Prism, will discuss the potential and limitations of digitalization in building inclusive societies. The last panel, titled Conceptualizing Access to Inequality, Moving Forward with AEI, will have panelists from across sectors discussing and analyzing the role of the index in the future. Today, we are delighted to have with us Professor R. Sudarshan, the Dean of Jindal School of Government and Public Policy. He has held distinguished careers in the domain of research, development programming, and governance. In 1984, he served in the Ford Foundation's South Asia office in New Delhi as Assistant Representative and Program Officer for Human Rights and Social Justice. In 1991, he joined the UNDP in India as Senior Economist and Assistant Representative of Governance and Public Policy. In 2012, he joined the OP Jindal Global University as the founding dean of the Jindal School of Government and Public Policy. He has an impressive track record of publications comprising books, articles, and UN policy reports, reflecting his interdisciplinary research, teaching, and policy experience in development programs, human development, law, governance, institutions, and policy. We also have with us Dr. Indranil Mukhopadhyay, who is an associate professor at OP Jindal Global University. He teaches public health, health economics, comparative health systems, and development economics at the School of Government and Public Policy. Dr. Mukhopadhyay has 15 years of research and teaching experience in the area of health economics and healthcare financing. He's held several research studies funded by the Department of Science and Technology, Government of India, World Health Organization, and several international and national publications to his credit. He is also the co-editor of the Jindal Journal of Public Policy. We also have with us Mr. Mangalam Kesavan Venu, who is the founding editor of The Wire, a news website published by the Foundation for Independent Journalism, a non-profit Indian company. He has over 30 years of experience in journalism and has worked with several leading Indian publications, including The Hindu and Hindustan Times. Prior to The Wire, he was with the Economic Times, where he was the opinion editor and wrote a regular column for the editorial page. He also hosts a discussion called The State of the Economy on Rajya Sabha Television, a parliamentary TV channel of the upper house of the Parliament of India. We also have with us Dr. Siddhi Gyan Pandey, who has completed her PhD in economics from the Center for Economic Studies and Planning, Jawaharlal Nehru University in 2019. She's completed her MA and MPhil in economics from JNU and BA in economics from Sri Ram College of Commerce, Delhi University. Her research involves game theoretical analysis of networked interaction and social network formation. Her teaching interests lie within the areas of microeconomics, game theory, mathematics and statistics for social sciences and networks economics. At Jindal School of Liberal Arts and Humanities, she teaches the foundational quantitative skills courses along with economics. I would now like to hand over the floor to Professor Deepanshu Mohan.
All right, a very good morning to one and all. I would like to start by saying that the idea to plan this workshop today and the date for it was largely influenced by the fact that it is Mahatma Gandhi's birth anniversary. It's on the occasion of Gandhi Jayanti, we felt that there was perhaps no better occasion to release the study which sort of in its conceptual design draws upon a lot of its ideas from Gandhi's own economic philosophy, and so does from Ambedkar's thought process. In defining his economic philosophy, Gandhiji once said, my idea of society, and I quote, my idea of society is that while we are born equal, meaning that we have a right to equal opportunities, all have not the same capacity. It is in the nature of things impossible. For instance, all cannot have the same height or color or degree of intelligence. Therefore, in the nature of things, some will have ability to earn more and others less. People with talents will have more and they will utilize their talents for this purpose. If they utilize their talents kindly, they will be working or they will be performing the work for the state. Such people exist most often as trustees or no other terms. I would allow a man or a woman of intellect to earn more. I would not cramp his talent or her talent, but the bulk of his or her greater earnings must be used for the good of the state, just as the income of all earning sons and daughters of a father go to the common family fund. They would have their earning only as trustees. For I want to bring about an equalization of status. The working classes have all these centuries been isolated and relegated to a lower status. They have been Shudras, and the word has been interpreted to mean an inferior status. I want to allow no differentiation between the son or the daughter of a weaver, of an agriculturalist, and of a schoolmaster. End of quote. At the core of Gandhi's economic reasoning and economic philosophy, the idea to create equal access of social and economic opportunities to all people, despite their status in a given society, was central to securing the economic development of a society as a whole. Ambedkar's views too, in this regard, were similar. Maybe one of those rare things where the two saw convergence in thought and action. We can surely debate on how can the state or a society through other institutions make this happen. But any discourse on studying or understanding the degree of inequality and its measurement from the perspective of incomes alone, whether observed under a global or a national lens, says very little about the actual inequalities or inequities that people experience and live with. There has been a pressing need to incorporate a more interrelational perspective in the development of a granular, meso-level approach to inequality studies, as argued by scholars like Amartya Sen, Martha Nussbaum, and many others, which would complement and align with macro findings, both in terms of measurement and analytical scrutiny. Our center has done this so far by employing ethnographic anthropological tools to study core socioeconomic issues from a grassroots community level. And our quest to be focused on issues affecting the most vulnerable amongst India's workforce have taken us to different corners of the country, particularly so over the last 2 years. That quest and inquisition still remains. We will continue to document, archive, and analyze the state of being of the invisibilized in the effort to bring out their voices in any ways possible. Access Inequality Index is also a step in that direction. The method, though, is different. The index should serve as a mirror in times to come for states across India to measure their performance of development, not simply through indicators that show how much foreign capital is invested in the state or how much growth in GSDP terms is increasing their growth performance, but also measure to get a sense as to what extent their own state populations have access to basic social and economic opportunities. that subsequently make them capable to grow, evolve, and perceive better as beings of today and tomorrow. This is also vital for invoking and expanding the civic consciousness of India's citizenry across states. Though the word access in general means a lot of things, it means a way of approaching, reaching, or entering a place as the right or opportunity to reach, use, or visit. It's here broadly conceptualized to encompass 4 A's or 4 forms of access. My fellow team members will briefly discuss this in a while from now when they present the report findings. What we want to do is to see that in the analytical framework of this index, there are 5 fundamental pillars of assessment where states across India and union territories are ranked. We rank them on the basis of performance in each of these pillars: access to education, access to healthcare, access to basic amenities, access to socio-economic security, and access to justice. Our report also delves deeper into the existing gaps within access performance observed across different segments of our population based on the area of residence, the divide between the rural and urban, caste groups, and gender. More detailed findings of our report will be presented by the author team, as I said, in a while from now. But before that, I would like to invite our school's dean, Kathleen Modrowski, to say a few words on her observations from the team's work. I must add that the unconditional support received in producing this index work, given the current social and political climate, along with the creative freedom that we've enjoyed, couldn't have been possible without the Dean and the Vice Chancellor's support. I would also like to especially thank our mentors, Indranil, Anamika, for guiding us throughout the process of working in producing this index. I'd like to thank our fellow authors, Latika, Richa, Vanshika, and Adwaita, the designers and editors, Shri Sharma, Rekha Pachori, team organizers, Vyonana, Ada, Prashanu, and more importantly, our IT and AV team for giving their time on a national holiday. Off to you, Dean.
Okay. Thank you. Thank you very much. Thank everyone for the opportunity to read the report, which I found was really exciting. I started out thinking maybe this was going to be boring, but when I looked at it, I saw what happens as I'm reading it. It leaves me with a whole set of questions. And I think any kind of index or report, that's what it should lead to, is the questions that you're asking, certainly about the disparities, the inequalities in various states in India. One thing that struck me is, coming from the United States, is if I'd look at this kind of a chart, and I would be able to say, they'd say Georgia is lacking, the state of Georgia is lacking in education and healthcare. I have a whole baggage of history, of events, of social structure, of migrations that come to mind without having to do much research. Whereas when I look at Goa, when I look at Madhya Pradesh, and I see the 2 different ends of comparison, I want to hear more. I want to hear the why. I want to hear the historical, socioeconomic background, also understanding more about the human settlement of the region and the movement. So this is, as you mentioned there, Deepanshu, there's a lot of work being done as far as using ethnographic means to discover the why. But one of the real values of this report that I see is, and I certainly hope it gets wide dissemination, is having people who are responsible in the state and the members of that state, the citizen as well, looking at the comparison and asking these questions. I like the idea very much that you've combined it with some of the points of opportunities and then the capability structure as well. That approach was, very interesting for me to see how it is applied rather than just separately. Usually you get an economic report, you get the income, And then you do not get the other nuances that really come from it if you're going to use something like capabilities, which is all important. I think we're seeing a shift in it. I would say again, one of, besides Nussbaum and Sen's work on it, I also think that, you know, looking at the other ways of, again, using ethnographic material is very important, and getting the opinion of people who are part of the state's members, the citizens, to have them be part of a cooperative kind of collaborative look at what the results are in these approaches. I like the use of, as I said, the 5 pillars. I think, you know, that's extremely useful. As a research tool, I would highly recommend this. Being able to see it, being able to analyze it, and I think you're going to have much greater discussion of these points when you have the individual breakout session and reports from the people who are working on these areas. One part that I do question is, I feel while you do include gender, I think gender is so important it ought to be cross-cutting in everything. And I would recommend a closer integration of issues like gender in everything you do. And also gender coming from people who are, as you emphasized, the voiceless and the invisible in that society. So I think you have to rethink some of the categories that you're using for, you know, measuring gender. You mentioned in the description, for example, on education, something that's very dear to me is, you know, use of certain criteria for measuring education in countries. You talk about definitely, you know, toilets is something that we know. Extensive studies were done in Karnal and elsewhere showing the increase in women, in young women in education had to do with private toilets for girls. And also the idea of, I think you mentioned this report, or it was another one, transportation. So, you know, introduction of transportation for young women by giving bicycles to people in different sectors. So I think the transformative areas that are hinted at but have to be further explored in this report are something that's really important. The other area that surprised me was access to justice. And when I saw access to justice, I saw that police and judges were 2 areas that were measured. But my own work around the campus here in some of the villages those are probably the least relied upon systems of justice, you know? And that one of the highlights of Haryana's justice system, of course, is the all-women's police station, which is never used by women who it was destined to be used by. It's just not. It's something that's for a different class. So going into, you know, more into caste and religious ideas or indicators, I think is very, very important, because there are all the built-in prejudices. And as you indicate, you know, this is, again, the indicators lead to questions. And I think that's one of the most important thing is questions that arise from these issues. Also, I was interested in, you mentioned, your team does in the explanation of the report, the effect of COVID. I just think this is going to be an ongoing part that's going to upend some of the statistics, and the value of having these this basis of the indicators is going to be that we'll be able to measure the change that's happening so rapidly, and that we still don't have the endpoint coming in yet. So I'll just close in saying I agree wholeheartedly that this is a very important survey. It's a very important tool. I think a user's guide to the tool would be really good too. I'm looking at from a university perspective and saying, you know, allowing faculty and students and other researchers and other agencies, what's the best way to do it? So I think, you know, providing a really hefty user's guide would be something good. And then you do mention very pointedly in your concluding remarks about this, that actually it is a work and it is a continuous work, and it is a continuous work in progress. You say it must be a continuous exercise, allowing for longitudinal comparison of states and access their performance relative to others over a period of time. So, you know, that's really important too, because I think the weight of comparison, the sense of competition based on comparison is very important. And if it is used, as you all indicate, not as the finality, but as a starting point in working toward meaningful social change and breaking down and identifying inequalities, that's a wonderful contribution. So thank you very much for doing this. And I really look forward to seeing the continuous work.
Thank you so much. Thank you so much, Dean Kathleen. I mean, those were very insightful observations. In fact, the next step for us in the foundation of the work will be to look more deeply at social composition. We had some serious limitations with respect to access to data when we were trying. I mean, gender was one of our key metrics of comparison across all pillars. And so was technology. Even I think the access to digital technology, which in itself is a gender enabling or empowering tool, has that effect. But we were at the stages of initially looking at open databases and public sources. There were some limitations that we were facing. But I think the next step for us in the annual work would be to build upon this, look at it more from a social composition base, not just look at gender, but caste, class, and other factors. Access to justice, I mean, this is a point which was 3 years, 4 years made, Richard would recall this, about why have we looked at, for example, police and courts. Because from a metric evaluative point, unfortunately, there's this tendency to only look at institutional infrastructure. But I think there are more ways, because more from an ethnographic perspective, this is something which is a challenge that we face, because we want to go in and look and understand the multifaceted nature of contexts that are competing against each other in defining the restrictions to access, right? But thank you so much, ma'am, for this, and we look forward to sort of work and revise and update our work. I do want to take this opportunity before I give the floor to our fellow authors to sort of thank and also have, if I can, just maybe very quickly share my screen. Is it visible? To also thank our dear student organizers who put phenomenal amount of work and effort in making this possible. And in the presence of Dean Kathleen and Dean Sudarshan, I want to take this opportunity to please maybe just virtually, sort of congratulate each of the student organizers. So if that's all right with you, ma'am, we'll just take a very quick few minutes to acknowledge the work that our journal team has put in making this workshop possible. It took a lot of work, months of planning, and Ada Nagar, who has been phenomenal in her work within the center. She was one of the principal team members organizing this. So has been Leonora Fernandez. So just a congratulations to all of them. Krishanu Kashyap, again, a research analyst with the center. They have been doing a lot of good work with the nickel and dime team. And the authors of the report, who have been, working very, very hard. And, it's, I was saying this to the team that this sort of work, which looks at a pan-India body of databases and streaming through, like so many numbers coming in, it took a lot of time filtering out. And just wanted to sort of thank and acknowledge the work of Richa, who works with the center. She's been there since the very inception. over the last 5.5 to 6 years. The very first project we did with street vendors in Delhi, she helped us conceptualize and design the study. So thank you, Richa, if you can see and hear us. Latika, who has been contributing as a senior research analyst for this project. She works with KPMG and wanted to associate herself on a project within the center. And this was maybe her calling for taking a lot of time from her end while managing her maternity leave. So I think she sort of, took a lot of time from her household responsibilities as well. And, at that time, Vanshika Mittal, phenomenal work. In fact, I sort of give a lot of the work on the labor of looking through databases to both Vanshika and Advaita. They have worked for months across the summer. In fact, during the second wave and the impact of the second wave, as it was sort of nerve-wracking for all of us, they were sort of looking at databases day in and day out to keep their mind occupied with this. So thank you all. And now I would like to give the floor to Latika. Maybe you should start with the presentation, and we will then get the panelists to get involved. Dean Kathleen, I'm aware that we have a prayer meeting for one of our students who passed away recently. So, ma'am, please exercise your discretion as and when you feel that you need to leave.
Thank you. Thank you. I will, Gwen, but I'd like to listen to a bit of
Thank
it.
you,
It's so interesting. Thank you very much.
Thank you so much, Deepanshu and Ma'am Kathleen, and a very good morning to everyone. Taking forward the presentation, I would like to begin with the content of the whole presentation has already been discussed by Deepanshu. So I'll quickly move forward towards highlighting the need or the answer to why this index. So we know that the rising debate on income inequality, as also earlier mentioned by our speakers, that the importance of being clear on how inequality is measured and understood becomes very important. We've seen that the focus has been largely on inequality of outcomes, and measured often through Lawrence curve, Gini coefficient, decile ratios, and others, which generally measure income or wealth inequality. But the literature on inequality of opportunities is rising in the past few years as well. So in addition to this, when we keep the sustainable development goals in the background, which aims to ensure that there's no one is left behind and aiming at reducing inequality globally, we see that one of the major factors of why India is falling short of achieving these goals remains underinvestment in human and social capital, which leads to uneven access to various opportunities. This, with the goal of achieving equality of opportunities rather than outcomes, it becomes very important to measure inequality from this perspective. Putting to this, we know that global data shows that COVID-19 pandemic has further widened the income and wealth inequalities across within the and between countries. And thus pandemic has not only contributed to inequality, but it has also changed the dynamics of the public service delivery, the working of institutions, be it government or private markets, and thus measuring inequality from a fresh perspective to take this dynamism into account becomes very vital. And in an era where we have social distancing and requires minimal contact, going beyond physical access and looking at other nuances of access becomes very important. Thus, the objective of the report are threefold. One is that we have created a multidimensional index to capture inequality of what? That is that we're looking where is the inequality within the axis of the key opportunities. Second, we are looking at inequality of whom or horizontal inequality as highlighted by Deepanshu, that we're looking at gender, we're looking at caste, we're also looking at where the person belongs. And thirdly, we are looking very briefly on the impact of pandemic, because the data which is present right now is very less and also not available across the states. So we have qualitatively briefly touched upon the impact of pandemic as well. So now coming to the core of the paper or the core of the report, which is access. What do we mean by access? So it is just not saying that, okay, how far, or just looking at the physical or the spatial distribution, but we are looking at the 4 A's, which defines the ease or the opportunity itself, which is available to individual to use the essential service or the institution. So 4 A's are availability, which looks at the physical access, whether the service is available or not. Secondly is approachability, which means geographical access, how far or how near is the service or the institution. Thirdly, affordability, which is the financial access. So, for example, if we say that going to a hospital or accessing healthcare services is too expensive, which India has one of the highest out-of-pocket expenditure and one of the least health insurance coverage, we know that it becomes inaccessible to a citizen to the healthcare service, to take benefits of the healthcare services. Thus, it becomes an important nuance to look at. Fourth is appropriateness, which captures various sub-dimensions such as timeliness, how effective or adequate is the service, and what is the quality. Just to give you an example, we know that it's often said justice delayed is justice denied. So in the pillar of access to justice, we have taken indicators like pendency of the cases, which marks the timeliness of the service, and that defines that whether in true sense the service is available, is accessible to the person or not. So given that SDGs and even the government's target of Sabka Saath and Sabka Vikas, given that they target on universal access to various opportunities, this report examines that how far the Indian states and the UTs are in reaching or in providing the universal access to the essential goods and service. And we look at imbalances or the unequal distribution of the deprivations from the supply side, and we have not looked at the demand side dimensions such as acceptability from the citizen side, whether what is their perception, because this would require a different, a very in-depth survey at an individual level, which maybe we can cover in our next versions of the report. But due to the lack of data, we have kept the definition of access to the supply side. So moving forward on giving you a consolidated picture of what the framework and the index is, that we have covered a multi-dimensional framework, because in general, when we look at a single dimension or one-dimensional income-based measurements such as Lorenz curve or Gini curve, they do not reflect the inequality of opportunity that arise because of the factors or the circumstances that are beyond individuals' control and for which they cannot be held responsible. So the index measures 5 key pillars, which is basic amenities, which has water, sanitation, housing, clean energy, nutrition, and very important in today's era, digital access, which is mobile or internet with the citizens. Then we have access to healthcare. We look at the rural healthcare, how affordable it is, and especially focusing on the maternal and the childcare health as well. Access to education is our next pillar, which looks at secondary education, particularly because achievement of elementary education has been almost reached to a universal stage. Next pillar is access to socioeconomic security, and then we cover access to justice. So overall, we have the whole index has 58 indicators, which have been put into 23 categories, and each of them relate to an important opportunity which is crucial to social and human development, and it improves the overall quality of life. In the capabilities term, they build important capabilities for an individual. Now, quickly coming to how this index was calculated we have taken the equal weights and a simple average aggregation technique, which is also used in many global indices such as Human Development Index. And each of the 5 pillars have been we have, for them, each of the 5 pillars, we have calculated the sub-indices using aggregation through arithmetic mean. And as you can see on the screen, we have the formula which uses the min and max. And that is how the index scores have been calculated for each of the 5 key pillars. And then we take the geometric mean for the composite index for all of the 5 sub-indices which are available. So if we can take this in detail further in the questions, if anyone is interested in looking up how is the detailed methodology or the computation. So moving on to the findings from the index and looking for the answers to inequality or equality of what, we first present the findings of our composite index. The composite index is, as I mentioned, that the sub-indices of each of the 5 pillars are aggregated to arrive at the final composite score. And the whole range of the index lies between 0.67, which is highest and is for Goa, and 0.23, which is the least index score. And we have grouped the states based on their scores into 3 categories: frontrunners, achievers, and aspirants. So putting a positive note to all the performance of all the states, the frontrunners have the index score as the top one for all the states. And we have seen that smaller states like Goa, Sikkim, Himachal Pradesh, they make the cut to top 5, but also that these governments have ensured to improve even their human development index. So they are also very highly placed in the human development index scores, which generally focuses on outcomes. So there is a relation between the state government's efforts in human development as well as sustainable development goals, and ensuring that they have the best access to basic amenities, health, and other opportunities for their citizens. So second is achievers, which have the median, the average scores, and aspirants are to say that perform the least. And we see that these states require a lot of effort to improve the access. Now, this was the comparison within the states, but if we look at, okay, what is the inequality in, we see that the highest inequality persists in the access to basic amenities. So access to basic amenities is what comprises of your, an extended version of Roti Kapda Makan, which is your food, housing, you have digital access, which is very important, access to mobile phones and internet. You also have clean fuel, the LPG access, which also matters a lot in today's sustainability environment. And then we have pipe drinking water and sanitation as the part of access to basic amenities. So there is a huge inequality among the states in this particular pillar, which is followed by access to justice, healthcare, and then socioeconomic security. The least variations or the least unequal pillar which we have is access to secondary school education. So that is the bright side of the picture. Now we'll move to the sub-indexes, sub-indices, which is for each of the pillar, and we will see that what each pillar comprises of and how the states perform, and within each pillar what are the inequalities like. So Vanshika, over to you.
Thank you, Latika. The first pillar that we'd be looking at is the access to basic amenities. The table on this slide lays out a total of 10 indicators across the dimensions, as Latika's already mentioned: clean water, sanitation, housing, clean cooking fuel, nutrition, and digital access. Column 3 particularly is interesting since it indicates the access dimension covered, as mentioned earlier, the 4 A's under each of the indicators. I'll be explaining this mapping with the example of sanitation. So whether a household or an individual has access to a toilet or not comes under the availability of sanitation. To understand its use or functionality, we need to gauge whether the toilet is maintained regularly and cleaned properly, which is done through the access to water for use in the toilets. We can move to the next slide. Most basic amenities have government programs running to ensure complete coverage within the country. These include Pradhan Mantri Awas Yojana, Public Distribution Service, individual household land schemes under Bharat Gyan, Jal Jeevan Mission, Ujjwal Scheme, and National Digital Communications Policy. Efficient implementation within smaller geographical areas contribute to the fact that on average, smaller states have an advantage and lie above larger states in their rankings. This can be seen since the front runners, mainly being Goa, Punjab, Kerala, Sikkim, Haryana, and Mizoram, are mainly the smaller states of the nation. This could also be the reason behind the lowest score of the union territories, in this case Dadra and Nagar Haveli, being above 0.3, while the lowest score for states, in this case Jharkhand, is at a 0.19. Can you move to the next slide? The table here marks the disparities among states and the lag in universal access. Some key findings of this pillar are the largest disparity among the states and lag in achieving universal access lies in access to water, which is the most fundamental of all human needs. It's marked in red in the table. Moving to housing, while as large as 83% of all households in our country live in pakka houses, of these, only 46% come under the category of good houses by NSSO. Even for the top 5 front runners, the average of pakka houses is at 95%, of which only 59% are categorized under good condition. While the table shows the disparity between the states is the least in digital access, please note that its all India average is the second lowest. This highlights the urgency to look into this aspect despite the many government schemes already running under this. Next slide.
Yeah, hi everyone. So beyond being an integral part of decent living standards, good healthcare is also essential for human capital development. So in evaluating the access to healthcare, we consider indicators for reproductive healthcare, medical expenditures, physical infrastructures of hospitals and beds, etc. So we've taken a total of 13 indicators, mostly from NFHS reports and Ministry of Health and Family Welfare, and also rural health statistics. Next slide, please. Our data indicates that the front runners are Goa, Tamil Nadu, Sikkim, and Kerala, while the worst performing states include Nagaland, Assam, Jharkhand, and Bihar. One explanation for this could be high public expenditure. Goa and Sikkim are few of the top ranking states when it comes to per capita expenditure on public healthcare. Meanwhile, Bihar and Jharkhand are some of the lowest ranking ones. However, this is only one part of the picture. Within the states, Goa and Kerala top the ranks when it comes to antenatal care and even postnatal care for that matter. These are areas where Nagaland is severely lagging behind. This is a cause of concern as our data shows that the lack of access to healthcare for marginalized groups is most pronounced for maternal healthcare. Hence, women from SC, ST, and OBC backgrounds tend to have more issues accessing the needed reproductive healthcare services. Next slide, please. Thank you. In exploring the interstate inequality, we know that some indicators have higher state-wise distribution than others. The number of hospital beds in public hospitals display the greatest standard deviation. Lakshadweep is the best performing state in this indicator with 4.41 beds per 1,000 people. In contrast, Chandigarh and Bihar are the worst performers with around 2.5 beds per 1,000 people. We also know that most states are far below the mandated SDG target and the global benchmark of 3 beds per 1,000 people. In fact, only one UT meets this benchmark, which is Lakshadweep. Moving on to institutional births, the percentage of deliveries in healthcare institutions also has diversity in coverage across the country, with the national average being 78.9. Pondicherry is the best performer with 99.9% coverage. Tamil Nadu, Kerala, and Lakshadweep also do very well in this sector. In contrast, we know that the northeastern states like Nagaland, Meghalaya, and Arunachal Pradesh severely struggle in this area. Next slide, please.
The next pillar is access to education. This includes 11 indicators across the dimensions of school, teaching staff, vocational training, and digital infrastructure. Please note that the index uses secondary education as the level to measure access to education, which is to say that all the indicators laid out in the table have been taken at the secondary level of education. This has mainly been decided due to the high enrollment and turnout rates already achieved already achieved in elementary education in the country. High performances in several indicators lead to Punjab topping the sub-index. This is due to several reasons. Firstly, 99% of Punjab schools have functional girl toilet facilities, which reflects in the fact that in 2019, Punjab reported 0 dropout rates for girls at the secondary level. Even overall, dropout rate in the state is at the lowest and enrollment is at the highest. Next slide. While enrollment rates have been increasing, several factors such as affordability and gender bias prevent certain sections of the population from accessing schools, which is why, along with enrollment rates, it is very necessary to look at the attendance ratios in these states. Least attendance ratios have been reported in Meghalaya and Uttar Pradesh in states, and Daman and Diu and Andaman and Nicobar Islands in the UTs. An interesting find of this pillar was that Chhattisgarh, Assam, Odisha, Bihar, and Jharkhand have the lowest average expenditure per student on secondary education. While on one hand, this reflects on the affordability of education, there is also evidence that this figure is highly correlated with the per capita income of the state. Once again, the all India average in terms of digital access is very low. This is very concerning in the context of the pandemic, where education has been imparted primarily through digital means. Up until now, we've seen that both schools and households in our nation are not sufficiently equipped, creating a larger gap due to remote learning. Next slide. Next, we move on to the access to socio-economic security. This slide details the 8 indicators used in this pillar that are largely clubbed under economic, financial, and social security. Social protections have not received enough attention from the government, keeping in mind that public expenditure reported under this, exclusive of healthcare, is only a 1.5% of the GDP. Next slide. As can be seen, Goa outperforms every other state, Goa outperforms every other state in all the indicators, resulting in a large gap between the shown index scores. Meanwhile, union territories do not have a large disparity in the scores. The lowest performing states in this pillar are Jharkhand, Assam, Uttar Pradesh, and Bihar. Next slide. Bank accounts available on a household level have the lowest disparity among states. This has mainly been achieved under the Pradhan Mantri Jan Dhan Yojana, where almost all states have achieved the universal target, except for a few such as Manipur and Jammu and Kashmir. According to the SDG 3.0 report, there are only 12 banking outlets and 17 ATMs per 1 lakh population in the country as of September 2020. This shows just how unapproachable access to financial services are in India. Even within these low averages, ATMs per 1 lakh population has the largest inequality among states and UTs. Northeastern states such as Mizoram, Nagaland, Meghalaya, and Manipur, along with Goa, provide the highest access to rural employment under Manrega when demanded. While this reflects that Manrega helps the extremely poor fight poverty, their working conditions are concerning when less than 50% of the working population in India in the non-agricultural sector is covered under any form of social security benefits. Even insurance schemes, including both life insurance and employee state insurance, have very low penetration all across the nation. Goa, a top performer in the employee state insurance, has only 26% of its employees covered. Next slide.
The next pillar that we're discussing is access to justice. When discussing justice, it is important to note that it refers to the 4 measurable public instruments of judiciary, prisons, legal aid, and police, which are essential in maintaining law and order. Hence, we've taken indicators such as vacancies in police and high court judiciary, prison occupancy, and the number of inmates per officer. We've also looked at the average number of villages covered under some form of legal aid clinic. This is particularly important since legal aid clinics make justice accessible and affordable to the rural population after the National Legal Services Authority. We've used reports like the India Justice Report, Indian Crime Report, and also data from the National Judicial Data Grid. Next slide, please. Sikkim and Nagaland top our rankings when it comes to justice, while Meghalaya and Uttarakhand have the lowest sub-index scores. This can be largely attributed to the fact that Sikkim and Nagaland do particularly well in physical infrastructure and human resources. However, state size might also play a role. Next slide, please. Starting with the efficiency of police services, we know that at an all India level, there is a problem of understaffing. Population per police person at an all India averages at 712, well above the recommended ratio of 450.5. There are major inequalities at the state level further. In states like Bihar and West Bengal, there is one police person for around 1,200 to 1,500 people. These lack of resources are also reflected in the number of police stations per 1,000 population. Both Bihar and West Bengal rank the lowest in police stations for the given population. Sikkim and Arunachal Pradesh do very well in this area. Moving on to judiciary, the vacancy of High Court judges is as low as 8.3 in Sikkim to as high as 70.3 in Andhra Pradesh. This has resulted in an astronomical caseload per judge for poor performing states. We know that the lower the population load on a High Court judge, the better the state rankings are. While understaffing in the judiciary is a major concern, a greater cause of concern is the lack of representation. On average, Indian states have 10% women judges. Bihar, Uttarakhand, and Manipur have 0% female High Court judges. The lack of gender representation in the judiciary not only impacts the direction of many verdicts, but also restricts the avenues of employment for women in the sector. Next slide, please.
Can you see my screen, sorry?
Yes.
Okay. So now we have seen that where was the inequality in terms of the various indicators and the pillars which we have taken. Moving forward to a very crucial part of the report, which is inequality of whom, as we need to know that across the individual or the characteristics which the individual has in terms of gender or caste, which is very important for India, and also where the person resides is an important indicator, is a perspective to look at, especially when it comes to inequality. So in India, the discourse on the divide between Bharat and India is not new. Around 65%, 66% of Indian population still live in Indian villages, and in totality, the access to opportunities and the resources has a clear spatial dimension and divide, and people in the rural area are worse off than in urban population across all the states. If, for example, if you look at basic amenities, we see that in terms of the sufficiency in availability of drinking water, there is quite a reach towards universal access. But when we look at approachability or appropriateness by looking at indicators of piped drinking water in the premises of the household, we see that there is a wider disparity in the rural and the urban areas. People residing in the urban areas have relatively higher access to unshared and quality, by which we mean that there is availability of water in the toilets, that is seen across majority of the states. In terms of housing also, we see that more people have access to pakka houses in the urban areas than in rural areas. And looking at the very important part where we have digital access, we see that 31% of the rural population they are internet users, but 65% of the urban population, on the other hand, are internet users. So there is a stark inequality between the usage of the internet between rural and urban population, but this inequality is a bit lesser when it comes to the use of mobile phones. So there is a ubiquity in using of the mobile phones in this age, which is a positive sign. When we come to healthcare, there are asymmetries between rural and urban India, mainly because of the predominance of the private healthcare, which adds to the cost of medical expenditure for the households. So there is higher concentration of private healthcare providers in the urban areas, and therefore we see the disparities. In the rural areas, the mobile technology and the improved data services, they are expected to play a critical role in providing or improving healthcare services, but there needs to be a lot of work in this area. The National Digital Health Mission of the government is still in its nascent stage, and we need to see a lot more implementation there. The shortfalls in the access to healthcare is indicated by the required number of the beds or accessibility to the equipments, even availability of the doctors and the medical staff. And this has been highlighted during the worst hit times of the pandemic, and we have seen the dismal state of the Indian healthcare system, especially for the rural populations. And in terms of overall access to justice, and other pillars like financial and economic security, we see that it is skewed against the individuals residing in the rural parts of the country. Say, for example, as Dean Kathleen already mentioned, that the access to courts or the police stations, since they are situated in the urban areas, as well as affordability of the lawyers, advocates, etc., they add to the cost of accessing justice to the rural population, and thus makes it less accessible, or there is more inequality which is observed there because of the fact that where they are residing. The employment opportunities, there is disparities in terms of the social security coverage, not only access but the quality of the decent work as well, and the how much financial services are available to them. Now, moving on to a very important part again, which is the caste. We know that as per the NFHS survey, around 45% of the ST population lies in the lowest bracket, income or wealth bracket, compared to 27% of the SC population and 18% of the OBC population. So there is a skewed distribution of wealth and income which coexists with the inequalities in the access to opportunities, allocation of resources, and availability of social capital for the Indian social structure. SC, ST, and OBC households, they lag behind in general, as per the findings of the report, in overall socio-economic development because of unequal access to the opportunities. For instance, if we see that marginalized caste groups, SC, ST, OBCs, are not allowed to access the same water resources, for example, wells and community stand posts, by the dominant caste groups in many rural parts of India. And these are based on the orthodox social beliefs, which creates a barrier to the access to many of the basic amenities to the households. So, since caste, we have seen that how inequality exists for various caste groups. Moving on to gender, which is one of the greatest barriers to human development, and it is reflected in the disadvantaged access to the opportunities towards development. So across all states, we have seen that both in rural and urban areas, there are fewer women in the workforce compared to men. So when we're talking about access to work first, we can see that there are fewer women. In rural areas, we know, we've seen that there is the worker population ratio is 19, whereas 52 for the males. And in urban sector, we see that there are 40, the WPR or the worker population ratio is 14.5 for females and 52.7 for males. So overall, not even a quarter of the women of the country are employed as workers in the so which shows that, and adding to this, there are even lesser females which are eligible for the social security benefits. So again, a very interesting fact, and this was, I think, mentioned by Dean Kathleen as well in the beginning, that how lack of access to water and sanitation facilities, especially in the schools, affect the dignity and the safety of the girls. And around 23% of the girls in India drop out of the school because of this fact. When we look at the amenities or ownership, looking at housing, we see that 60% of the married men report owning the housing on their own, but this ratio is less so for women, which is only 22%. usage of mobile internet is increasing by women, but it remains considerably lower when compared to men. And we have higher dropout. We have seen that the gender parity in the justice system, it is not only about the representation within the system, but it is also about the relative the safety net which is provided to women across the nation. There is no doubt in our minds that the higher crime rate for women in India makes it extremely unsafe in many of the states and parts of the country for women. And it is an important opportunity to which should be accessible and universal to women to be in a safer environment physically as well as through the justice institutions which are available. Along with this, when we have seen inequality of whom, the next part of the presentation highlights that it relates back to one of the initial parts which we mentioned about the outcomes versus opportunities, the whole debate there. So outcomes, as we know, are the ends which result outcomes are the ends which have been the result of various means or the processes which relate to the access to basic opportunities. So what we have done is that we have tried to make a correlation between the outcomes, looking at the GDP of the states, and the opportunities which are there through the overall ranking scores or the composite index. And we see that there is a high correlation, and the state with the high income performs better in overall ranking, or vice versa. We can say that the states which have higher access to basic opportunities perform better, results in better outcomes or have better income, and thus will have better economic growth and development process. So this is something which is available in many of the literature as well, which shows a high correlation between outcomes and opportunities. But the focus of the governments should be more towards achieving universal access to opportunities rather than just looking at the outcomes or the ends. Another dimension which we have looked in the report is not only in addition to rural and urban disparities to where a person resides, we have also looked at the regional disparities, dividing.
Latika, just a second. I just add that Venu sir suggested this earlier when we were talking about the idea for this panel. So we thought of adding a few of these interpretative results, and it would be great to hear his thoughts. Please carry on.
Okay. So yes, this has been added in the later parts as the Dipanshu mentioned. So regional disparities, we see that the front runners have been dominated. The front runner category has been dominated by the southern states. We have 5 southern states which make it into the top category, performing category. And if we see the achievers, we see northeastern states which dominate here, particularly for the indices. If we see for education and healthcare, here also we see that southern states dominate among the front runners in both the pillars, whereas northeastern states, they lag behind in both. They have their own geographical, we understand that they have their geographical and other geopolitical issues, which makes it difficult to ensure universal access. But at the end of the day, for every citizen is equal, and we need to ensure that there is universal access to basic opportunities for their development at the end of the day. So by this, this is the end of the findings which we have from our report. Way forward, or how it's going to go forward for us and the university, I would like Deepanshu to, Deepanshu, would you like to take up this part, please?
Yeah, so I mean, just very quickly, because we want to hear our dear panelists, and thank you so much, Latika, Vanshika, and Advaita, for very comprehensively trying to present some very fragmented and complex findings that was emerging from our study for the purposes of this presentation. For those who are looking for shorter presentation, we will also have a small presentation by authors in the evening panel, where we have Maitreesh Ghatak, Nilanjan Sarkar, and Roshan Kishore. Going forward, we mentioned this, and earlier this was pointed by our dean as well, that we do want to take this forward as an index which evolves from time to time as a way of understanding dimensions of access across not just social composition, but also looking at different aspects where states and how some of the better performing states are evaluated from a more micro, ethnographic lens. I don't think you can, it's like, you need to get both of the hands talking to each other, where if you have a macro level study from an index giving us a perspective of which states are doing better in one, for us, for example, Punjab's performance in education was in our sort of intuitive sense a surprise, and we sort of were looking back again and again in the data that are there any glitches, or is there something that we're missing out? But that's the point. You do want to get a sense of a macro perspective or a bird's eye view, and then take a worm's eye view by visiting some of these states. Unless and until we don't have support from the local jurisdictions and the state authorities, I think it becomes difficult. And there's a reason why certain institutions have better network capital to be able to tap into that. But we hope that the dissemination of the study creates sort of that interest. We do want to capture the progress, and a dashboard has already been created where we put the raw data of the index out. We will put the recordings of the presentation and the PowerPoint itself. So it's all going to be accessible to everyone who's looking to take this. Feel free to critically analyze the results and share with our team. Professor Siddhi has already done that when she was reviewing the report, and her insights were incorporated. So it's a work in progress. And there are issues with indices. You always can pick up as much as you can, and you have to leave a lot aside. And what you leave aside becomes then a critical point of distinction. So there is an effort taken here to get what we may consider as the best or the best possible scenario to give a sense of where we are. And unless we don't do that, it's like the same thing with institutional rankings. There are a lot of issues with the way the ranking structure is sort of designed in education for higher education institutions. But still there is this quest for benchmarking within policy making and thought, which has sort of been the dominant part of the discourse. A final point is that we do want to look at how the pandemic itself has exacerbated the existing inequities. There has been a struggle to be able to get data, and I would say, as far as I can, that there is a sort of a lack of cooperation among state authorities and also at the national or union level to be able to get us a sense of how states are performing across different indices. And that's maybe the nature of the sense of politicizing a lot of the work around national data level collections. But we hope that in the next year or two, when we get a better sense of the picture, some of our own centers' work has looked at the impact of the pandemic within education, healthcare, and we've been having working papers. We've had around 6 papers looking at the impact of the crisis on the informal landscape of workers, domestic workers, street vendors, waste pickers, the industrial workers who are working on subcontractual or ad hoc exploitative contracts. We've done that work, and ethnographically that's documented, and it's presented also in form of video essays. But we do want to get a better sense of how the macro perspective of the impact of the pandemic can be evaluated. So with that, we'll maybe probably pause in here, and we'd like to sort of get our panelists involved in the conversation now. In terms of the format, as discussed before, Latika, you could just maybe stop sharing the presentation for now. Thank you so much. And we'll just invite maybe first Dean Sudarshan share his observations, and then Venu sir, Indranil and Siddhi. 10 to 12 minutes maybe of time for your opening remarks. And we have towards the end some time where there can be a back and forth with authors. And we look forward to your response. Thank you so much, sir, and off to you, please.
Thank you very much, Deepanshu, and thanks a great deal to the team that prepared this access inequality report. I'm quite delighted to look at the report. And let me first say that Dean Madrowski suggested that you should produce a user's guide to how to use this report. But I'd like to make a point that's a little in advance of that, which is that what Deepanshu and your team, what you've done is a phenomenal contribution to the pedagogy of our university. In other words, all of the people who've been involved in preparing this report have learned a great deal and have learned it in a way which is much more meaningful than many of the courses that we teach in a lecture format in many of our programs. So this is a kind of a learning by doing exercise. And all those who've been involved in this are, I dare say, much more competent for having had the luck to work in this team in preparing this report. I'm not too, I don't think that any government in this country will take any notice of your findings at all, right? Now, I say this with some experience because when I worked in UNDP, I joined UNDP because I was so excited by the first Human Development Report and the articulation of the capabilities approach by Amartya Sen. And so I left the Ford Foundation and joined UNDP. And so one of my major concerns was that we should produce human development reports for the states of India. And then I had a big argument with the headquarters in UNDP because they wanted the human development report to be prepared by an independent set of scholars and not done with the government. And I argued that given the way the Indian government works, Amartya may have most brilliant ideas and so on, but nobody will take any notice of it unless he's been asked to head an official committee and produces a report that is official, right? And Amartya, of course, prides himself in saying that he's never participated in any official committee and has been, I don't know if he's been asked to, but he's never accepted any such government portfolio to work. So I argued that the report should be official. They should be owned by the different governments. So having won that battle, we had this large project where we started off with Madhya Pradesh. Sanket was an NGO, and we had Sandeep Dikshit lead a team of young people working with Digvijay Singh at that time, produced the first human development report for a province or worldwide. It's the first provincial human development report. For Madhya Pradesh, that was followed by 2 or 3 others. And then we had this project with the Planning Commission, which was headed by Rohini Nair. And we started the Planning Commission encouraged and supported a number of states to produce human development reports. So it looked very optimistic in the beginning, because when the Madhya Pradesh report was tabled in the Assembly of Madhya Pradesh, the opposition, which was then the BJP, jumped up and attacked the government and the Congress governments of all the previous years for the sorry state of affairs that the report depicted about Madhya Pradesh. And Digvijay Singh, to his credit, stood up and said that the first step in tackling a problem or solving the problem is to recognize what is the nature and the intensity or the depth of the problem. And the Human Development Report gives you a picture of how bad the state of affairs is in Madhya Pradesh. no point blaming past governments and so on. We should try and do something about these results. And so we then, ended up, creating. One of the good things about the way the government did our human development reports is that it stuck to the principle of independence of authorship in a sense, because they were not produced departmentally. They had the imprimatur or the official status of the report, but they were prepared by scholars in different states. Mahendra Lama worked on the report for Sikkim, Jayati Ghosh did it in West Bengal, leading a team of independent scholars. So in that sense, the contents of the report were not manipulated or biased to paint a rosy picture that you might expect from, the political class might wish to have it, or the bureaucracy might wish to have that. So those reports are, have been prepared by teams that are actually independent and had this editorial independence, and were also official reports. So the hope then was that since it's an official report tabled on in the assembly and the different departments were involved, they would take notice of it. But one of the things that happened, and this often happens, the human development report is a means to an end. And the end really is that you have a set of policies that address the serious gaps and shortfalls that these reports produce. Now, did that happen? I'm afraid not, because producing the report became an industry in itself. So what is meant to be the means became an end in itself. I mean, you had some interested bureaucrats and some interested departments working on it. They produced a report and it's published. And the idea that it would be followed up. And so what I'm trying to say is that even though we started off assuming that if it is an official report owned by the government, the chances of its findings and its policy recommendations would be taken seriously was belied, right? So then there's a fat chance that a report of this kind that we produce, is going to get noticed. So therefore, I'd emphasize that we should do these reports, but do them really because we want more and more people, more and more of our students, capable of doing this kind of thinking and analysis. So if none in government shows any interest in this report, I don't see that as any reason to be disappointed. They don't show any interest in their own official reports also, right? So bringing about policy changes and getting governments to act on findings, targeting where the serious shortfalls are and so on, require another set of strategies, and reports won't do that. So I'd say that therefore there is, if you like, enormous value to the work that you do, because it's a great training ground for the kinds of things that we want our students to learn and to accomplish, because these are skills and techniques. I mean, drawing inferences from data, being able to produce something that summarizes the findings of a very large data set. All of these are very valuable, and they would come into use in many, many walks of life. So I must express my gratitude to you for having shown that, by involving a lot of young people, students and others, and producing a report of this kind with the kind of, multiple skills are demonstrated in this, including the presentation, the graphics, the summary of findings. All of that is extremely valuable. And so discussing this, I would see it as a very important part of our pedagogy, of our what we are there for. The raison d'etre of the university is this, right? So I must thank you for that, but don't have any expectations that any government will take any notice of this. I want to particularly welcome the fact that you introduced into this. See, the approach is very good, because you can see that the problem with the Human Development Index is it has two outcomes, which is life expectancy and access to knowledge, and then it has per capita income, which is means to an end. So it kind of mixes up, what you've been describing as, opportunities and outcomes, right? So in the capabilities approach, there is a well-reasoned basis for focusing on opportunities. You have a nice quote by from Sen and Dres on it. That outcomes are expected to follow, but at least you must have some equality of opportunity. And you made the same point by quoting Gandhiji saying the same thing when we started this session. So, having said that, I think these we can discuss what should be the indicators, variables, what dimensions should we look at for opportunities, and so on. And I'll end by just complimenting you for introducing justice, but also saying that it's very unsatisfactory because, firstly, when it comes to justice, I think the great majority of people in this country use the justice system to harass one another. I mean, they don't expect a dispute to be actually resolved. Very often cases are filed only to harass the other side, and then to continually appeal, not to accept the verdict. Unfortunately, the government also has the same tendency, which is never to accept a lower court's decision and to appeal it to the High Court and appeal it again to the Supreme Court, because you have the right to appeal. And bureaucrats think that because there's a right to appeal, if they didn't appeal, they would be causing a loss to the revenue of the state, and they must file the appeal. And there's a vested interest and lobby of government counsel who like this to happen, because their earnings depend on governments not accepting any verdict of any court until you go all the way to the Supreme Court, no matter how many years it takes. So we are making a dysfunctional use of the justice system, right? So with the result, there is a kind of a Parkinson's law here, where if you increase the number of judges, that doesn't somehow make much of a difference to pendency rates, the number of cases that continually keep piling up, even though you steadily increase the number of judges. So looking at the number of judges and that, I think we need to look at this. Actually, we need a much more anthropological sensibility about what people do to resolve disputes. Now, the Khap Panchayats of Haryana, which Kathleen mentioned, get a bad name because they are opposed to Sagotra marriages, and it always makes the news. They excommunicate some couple, or it takes more extreme steps. But by and large, that institution has flourished for as long as it has, because with respect to family and property disputes, their verdict is accepted by the community, and people go to them, right? That's why they are there. Nobody went to those, so you don't look at the demand side, but there's a great deal of demand for non-state justice institutions in our country. The supply side, you look at the formal justice system, and recently the Chief Justice of India made a comment that this British inherited formal justice system is out of sync with the mores and expectations of our people, and that we need to revisit this. And so this may be a problem, because when we adopted the Constitution, all of the draftsmen were barristers at law trained in the British system, and no one paid any attention to the fact that you might have, others, India had justice systems and dispensation of justice before the British introduced the formal structure of the courts, right? So this is something that we need to do in the future. So I'd say that therefore, and then looking at the number of police. Now, my colleague also did a report which no one takes any notice of, called the India Public Policy Report. Rajiv Malhotra led a team, published this report, which looks at policy effectiveness. That's how he defined it, of the different states, and ranked the states according to policy effectiveness. And Sikkim, interestingly, came out on top of that measure of policy effectiveness that Rajiv had. But one of the dimensions he had was rule of law. He didn't call it justice, he called it rule of law. And he looked at, again, how many policemen are there for population and so on. But then there's a problem with that, you see, because you have to be more fine-tuned. In the Northeast, because of security concerns, it's a highly militarized place. So there's a lot of investment in police, armed police, different categories of police, and so if you just looked at the picture and said, how many police are there for population? And we assume that, the more police there are per 100,000 population, the more safe the population would feel. It would probably, in many of these places, be the opposite. The more police personnel you have, the less secure the people would be, right? So we need to look at some of these things. So that's all I'd say for this. But
thank you. Thank you so much, sir. Thank you. Thank you. And Venu, sir, please, after you. I know you patiently waited. You're on mute, sir. You're on mute.
Am I audible now?
Yes, sir.
Yeah. So thanks, Deepanshu, for inviting me to give my comments. And at the outset, I think you've done a good job. I mean, your people have done a good job of beginning this exercise. And the frame, broadly, I would go with I would endorse the framework that you have adopted to assess both access to opportunities and capability development of capacities and also outcomes. Having said that, I would also add that there is, as you go along, Deepanshu, you must do a lot of creative, refinement of within each of these verticals, whether it's access to health or access to education, access to justice, access to sanitation, basic amenities. It will be a great exercise for your students and great learning also for your university, for all the researchers, to actually, as you yourself said, there's a bird's eye view and there's a worm's eye view. I think it will be a great exercise for students to actually go down to the ground. I'm saying this because I'm a journalist for 37 years. I've only done, I've traveled extensively. I've covered 20-30 elections. During elections, we, go to remote parts of the country. And we precisely, in a very informal sense, we ask these questions, So for instance, for instance, last, say, 30-35 years, whenever I go to some backward districts of UP or Bihar, my two simple questions that I ask villagers or women in the villages or the elders in the villages is how many girls went to school, say 10 years ago, 20 years ago, how many girls in your village are going now. So, I mean, anecdotally, or how many people had pakka houses 20 years ago, and how many people have pakka houses today. I mean, these things have been. There've been structured research projects on these lines. Devesh Kapoor and all have done as part of their own exercise understanding both access and outcomes. They have been doing this, especially taking districts which are dominated by Dalits, dominated by backwards, where there is, or tribals, where there has been very little progress, as it were, relative to other, other districts which are dominated by the upper caste. So I think we are a very complex society. So while the framework that you have devised is I would say, a very good starting point, but from here on, for more detailed or for more nuanced learning, you must go to the ground. Your students must go to the ground. I don't know how expensive it would be, but to understand, the subtext of our, different regions, different cultures, different, caste dynamics. Like, for instance, I'm not surprised that the South comes up on most indicators, comes up ahead of the northern states, the landlocked states, right, as it were. Part of the reason, obviously, also is, as your dean was also pointing out, if you look at the social history of the South, Tamil Nadu, etc., the politics of social empowerment happened there in the 50s. So there's a lot less, there is, of course, but lot less contestation between, for empowerment, for caste reservations, for state-led kind of empowerment. You'll see these much more intensely being contested in the north, as we recently saw that Nitish Kumar and a few politicians of Bihar, actually across the board, Nitish Kumar and Tejasvi Yadav personally met, requested the Prime Minister for a full OBC survey. Right now, there's a reason why such demands don't come from the South. Right. So these are some of the complex issues that I think you need to sort of to understand, maybe through surveys. A good way to, like Kathleen was talking about gender. Now I'm perennially sort of puzzled by the fact that women's participation in labor. I never understand why in India, while the average may be 19 or whatever, as one of your researchers pointed out, but again, there is a South versus North divide. On everything, there is South versus North divide. Per capita incomes, southern states average would be about $3,000 plus, 4,000. Northern state would be at the about $1,200, or even below that. Bihar is even below $1,000. So go, as your researchers pointed out, there's a correlation between per capita income and other social indices. Now, that is one aspect, that is pure data, studying correlation. But the point I'm making is, it's important to understand why in Bihar, labor participant ratio is 4%. I mean, I cannot for the life of me believe that only 4 out of 100 women are actually in the labor market. So what are the other 96 doing? Now, we were told, 2011 census, NSO, we were told that a lot of economists like Surjit Bhalla and many other economists came up with this explanation when the labor participation ratio of women was dropping. They came up with the explanation that India is progressing, becoming more prosperous. So women are actually not falling off the labor force. They are voluntarily falling off the labor force because they are trying to retrain themselves. So this was the narrative in 2010-11. So now I see one has waited for now more than 10 years. One would expect that those women who fell off the labor force, who voluntarily, as it were, went off the labor force, would have trained themselves to come back. Not happening. Actually, it's falling even further. So I think these are these gender puzzles, for me, I don't think any economy in the world can, or any society, whether you can socially progress or economically progress, if you take, say, UP and Bihar, women's participation in labor force at single digit, and these two countries together are the size of America. And it is, the consensus is that these Hindi heartland states, the next 20 years of Indian social and economic development hinges on how these states perform, right? There is no, there is no contestation on that. So therefore, I think should be a special focus on understanding these states. What the hell is going on here? See, South is okay. South, there was a World Bank report which says that Southern demographics now, they mirror much more the developed countries, in terms of the aged population ratio to working population. But the real story of India's future in terms of what you do with the working population, the younger so-called demographic. Narendra Modi keeps talking about 3 Ds, demographics and demand, demographics, and whatever. I forget what the third D. No, so I think we have to study demographics, and within that, gender. So what I'm trying to say, Deepanshu, is that while your broader, I agree with the broader framework, but inside each vertical, there is a need to refine our learnings, and there's a need to do it. Sometimes, government data can come with a lag, can come, depending on the government's proclivities. This government reached a point where even NSSO data, which India, which IMF, multilateral agencies, world over, which was India's NSSO data, was kind of, considered a very stable and, very authentic in terms of methodology, etc. Everybody considered NSSO data with a lot of respect, but this government came and they started doing things which kind of which also ended up discrediting NSSO data also. For instance, before the 2019 elections, they never accepted the unemployment data which came in 2017-18. Like, of course, after winning the election, they accepted it. But what I'm saying is, as Sudarshan said, I don't think you should bother about whether government takes you seriously or not. Nobody should bother about. We should only bother about our learning. If the government did not take UNDP report seriously, they doesn't take its own report seriously. So I think this exercise should be purely driven as a means for your own learning, for your own researchers, getting at the truth as far as possible through various means, methodologies, and to figure where is India headed in terms of the Gandhian objective of access to the poor, access to the the under privileged, access to the lower caste. So these are issues which are very much alive today. So whether it's a digital divide or whether it's access to education, access to health. Also, I'll make a final point. Some of the flagship schemes of the government, whether it's low cost housing or Ayushman Bharat, the insurance scheme, you might want to study these, the outcome of these, and you'll find it very interesting. For instance, during the pandemic, the southern states performed very well in terms of the use of Ayushman Bharat insurance scheme, because the southern states, even before Prime Minister Modi announced the scheme, were doing very well. They're covering about 70% of the population through private insurance also. The state was paying the premium, but the private hospitals were also participating in. You'll be surprised, in UP and Bihar, the numbers of hospitalization under the scheme were barely in hundreds, 800. This is ridiculous, for a population of, as UP and Bihar are, to over 300 million. And you have, Ayushman Bharat hospitalizations under that scheme at some 900, 800, I mean, these are shocking statistics for me. So anyway, so these are, so it has to, I mean, I congratulate you for starting this. You can actually, don't bother about what government thinks about it. Do solid research, do some good surveys. I'm telling you, the media will pick up your stuff and media will run with it. Because today, everybody wants to know the truth. And a lot more truth is coming out of civil society initiatives than from the state. Thank you.
Thank you so much, Venu sir. No, I mean, all of the observations that I think both Dean Sudarshan and you made are well received. In fact, there is a sort of a way in which we go forward in designing our studies to have more worm's eye perspectives and balancing out bird's eye view. I think just the way we'll have to see is how resources are mobilized.
Yeah.
I must add that even for this particular study report, we had no external or internal funding, and
Okay.
that sort of creates a barrier in the way in which you can. So a lot of the work we've been doing, even ethnographically, looking at vulnerable workforce groups, because that's the meat of the center's work. In fact, in the last 5 years, there we try to, and the presentation of that work often used to ask us this question, that what actual macro standpoint you have based on which you are providing these worm's eye view, because from a policy perspective, solutions will come only from states or civic bodies or at a union level. So it's like you if on one hand you get like a macro, a micro meso level, like a very granular perspective on looking at the nature of issues. In fact, most of our writings also are trying to kind of race towards that. The issue is, well, we have a structure, we work in a certain way, you give us a sense of a data or a starting point. But yes, I do agree. I think maybe in the way we design the reportage, we can maybe narrow down on the top 3 or 4 performing states which are doing well, and we are seeing and we are getting curious. Like, I'm very curious about Punjab in terms of looking at what's happening with education. In case of healthcare, if a certain state is doing well, what is basically that they're doing well in terms of a certain metric formula. And we can manipulate rankings as well in terms of certainly focusing on targeted indicators, and that has its own effects. But we also have in the evening a panel discussion with Maitrish, Roshan and Nilanjan. So that discussion itself is more on the way forward. So I'm hoping we'll have some institutional collaboration as well, which can help us, take the work forward. But appreciate your inputs. Indranil, who has been a mentor for, in fact, in the work around health, he was also one of our first responders on the study when an index like this was conceived. I think this was 3 to 4 years back when we had a discussion on our campus. It was a much small organized affair, and he had given us some very useful inputs. Indranil, off to you, and then Siddhi. Yeah, please.
Thanks, Deepanshu. I would, first of all, apologies because my Wi-Fi network is not working, so I'm taking it from a phone. My internet might work out, so I may not be. Am I audible? Is it working adequately well now?
आपकी आवाज बुलंद है, आप बोलिए.
Okay, thank you. So, yeah, of course, I would like to first congratulate all of you, Latika, Rita, Vanshika, Advita, and of course, Deepanshu, because as a researcher, I have a feeling how what kind of challenging task you have embarked upon. And without, like Deepanshu has mentioned, without much resource support, and the point that the introduction mentioned about the pedagogical refinement it brings out, I think it is hugely commendable. No, it's not easy when you are trying to bring out 58 indicators together, link them conceptually, ground them with data, and then develop a narrative, weave a narrative together. And in such exercise, the most critical part is to recognize systematically the challenges and note them down and periodically make improvements. I think you guys are making a considerable progress towards a very, very commendable progress towards that. Making this, this is a brilliant start, and you are absolutely spot on in your approach and trying to make so thoughts I had in my mind that how this can be made better. You have already mentioned that you would be taking up. For instance, see the conceptualization of access, like all of us are recognizing it is not so easy. Access is an intermediate outcome. It is not a final goal that we are bothered about. It is so, like you have also mentioned, it is one of the enablers. At the same time, access is also not at the level of outputs and inputs the systems tend to measure and provide. So in this complexity, on one hand, not at the level of final outcomes, which are much easier to measure, and then not even in the at the level of inputs and outputs, you are trying to conceptualize something which is multidimensional. I think it's a very fairly complex, challenging task. I am really becoming a big fan of your work, all of you. Kudos. So of course, there are methodological challenges. There are indicators that you can bring in. There is a need to strengthen, particularly Latika mentioned that we have more data on the demand supply side, but we need to bring in the demand side. Absolutely, there is no denial of that, and I'm sure with more time and resources refinements, you will do that. Uh, so, but one of the major issue and the conceptualization of justice, Professor Sudarshan and also Professor Kathleen has mentioned, I feel somewhere that needs to be linked with the nature of Indian state. Two very the state, it being to the class interest at one hand, and also remaining grounded to the semi-feudal nature. States which have been able to move away from these two tendencies and bring out elements of solidarity and progress have done well. Venu and others have mentioned traces of it. I think if you look at your the correlation, I was about to suggest that we need to look at the correlations here and look at the enabling factors like income. I think that is a big revealing story. The way Gujarat having double the income or more than double the income compared to states like Chhattisgarh or Gujarat and Haryana, and doing as bad in terms of access reveals those tendencies. One being very rooted into its feudal tendencies, semi-feudal tendencies, Haryana, and the other being completely compromised to the class interest, Gujarat. So both of them are not able to bring about access significantly. And I think that's where I would like to, think about bringing participation and democratization of the society. I think we need to, and that these are critical enablers of justice. Can we think of it? There is a contradiction because these are whether participation of intermediate outcome. Through participation we achieve many things. So I think that can be one theoretical suggestion I would make. Yes, I think a lot has already been said, but somewhere your report also talks about the nature of state in major way, particularly the democratization part. The Venu has already talked about it, but the kind of data we have access to. It clearly shows your report cannot be done without better, some improvements need better data. For instance, you mentioned that National Digital Health Mission. Look at the entire nature of the state. It cannot provide us reliable data on how many hospital beds it has in each district, how many specialists it has in each district, how many general practitioners it has in each district, how many people it provide access to safe medicine or safe, diagnostic services. But it wants all of our private information, health data to be collected and collated. Good data system tells a lot about the nature of state. Whether, because without, like Professor Sudarshan said, the experience of Madhya Pradesh, without good data, we cannot make change. So here we see that the state is continuously trying to use data, use information, use our personal records to be a police rather than progressively address our developmental needs. I think somewhere in the conceptualization of justice, I think we need to bring in openness and democratization elements of it. There are other reports which bring in, so say openness in budgetary participation. Can we bring some of those elements and link them in this? Of course, there are many refinements that you would continue to do, and this will bring out a lot of policy relevance. And this is the task of, I think, research community as a whole to tell the truth. There would be a day where, this would be a benchmark to assess whether states are doing good or not. And access would be a critical policy and I think parameter in policy. There would be a state which would be more responsive to such research. And with that hope and with lots of good wishes for your team, I would close. Thank you so much.
Thank you so much, Indranil. Siddhi, you've waited patiently, and we don't want to take any more time from you. Please go ahead. Thank you.
Good afternoon, everyone. Thank you, Deepanshu, for giving me this opportunity to participate in and contribute to this discussion. As Ada already mentioned in my introduction, my own research is exclusively in the area of theoretical economics, where I rely largely on game theoretic analysis. So reviewing this report has been a learning experience for me as well. But apart from the contribution that this exercise has to the process of learning for us, for our students, and even if the governments don't take notice of this index and completely ignore it in their policy making, I still feel that, and this has already been said, but I would like to repeat that, I feel that this is still a powerful tool to hold governments accountable. And we, as part of the civil society, through the various ways in which we engage with public discourse and we make demands of the government. So we can use this index, I think, to articulate our demands and our expectations. So in that sense, I think the framework is very useful and very powerful. After reading the report, I have a list of remarks / questions, and I'll now share those. I hope that Deepanshu, you and my fellow panelists will excuse me if some of my comments or questions reflect my lack of experience with empirical analysis and the kind of methodological challenges that come with it. Since the importance and relevance of this index has already been highlighted, and I wholeheartedly agree with everything that has been said, so I'm just going to move on. The first thing that I thought was, so in the report and in today's presentation as well, the discussion that motivates the need for such an index, it focuses on the unequal access that people in this country have to basic amenities, education, healthcare, social security, and justice. These inequalities, they exist across states and union territories, but they also exist across social groups, across rural-urban spaces, and across genders. And the analysis of inequalities across social groups, genders, and rural-urban spaces is done in the report by comparing various measures of access along these 5 pillars. But the AEI, it ranks only states and union territories by overall degree of access along the 5 pillars, right? So to that extent, I found the name Access Inequality Index to be a bit of a misnomer because, and hear me out, the nature of the index is like that of the Human Development Index and not like that of the Gini Index, which is an inequality index. So that said, I understand that to an extent, greater access to things like amenities and secondary education translates to lower inequality and higher equality of access across the population of a state or union territory. But ultimately, the inequality of access across states is being measured by looking at the variation in the index values across the states, with higher variation implying higher inequality and lower variation implying lower inequality, right? The index number corresponding to any state or union territory, it tells us very little in terms of equality or inequality within the state. And it can be a bit misleading because if with all the motivation, we are interested in inequality that of access between different groups and different genders and rural urban spaces, but the index number, it gives us information only about access. And from what I understand, the policy goal then for a state with low rank would be to climb up the rankings or to improve their index value, since increased access may not immediately lead to a better ranking, but just the goal could be to increase the index value. So I just felt that, the name Access Inequality Index, it might be misinterpreted as this being an index of inequality, whereas, indices are used that way to look at inequality. So just a small note on that. But I do understand that access in itself, higher access translates to higher equality. So in that sense, it also makes sense. So this was the first thing. The second thing that I wanted to talk about was there are 4 ways in which access is being understood, is being conceptualized, which is approachability, availability, appropriateness, and affordability. And but when I went through the list of the indicators, I find that affordability is not being measured by as many indicators as the number of indicators that I used to measure approachability, appropriateness, and all of that. In particular, I found 4 indicators, 2 for health, of which one of them was solely focusing on reproductive health. And then there was one for secondary education, and there is a small note on that as well in the limitations section. And there was one more for piped water. So I feel that this can be a bit of this is just, again, like I said, I'm sure there are a lot of data constraints and other reasons for this. But affordability is because we are not really making a distinction between these 4 ways when we are saying access. And in today's era, I think affordability is a real challenge. So somehow I felt that, so for example, according to the economic survey of 2020-21, India has one of the highest levels of out-of-pocket expenditures, which is contributing directly to high incidence of catastrophic expenditures and poverty. And this is in the context of health. I'm talking in the context of health. And about 65% of deaths in India are now being caused by non-communicable disease, which includes heart disease and obstructive pulmonary disease and stroke. So I found that when we are looking at affordability in healthcare, we are focusing largely on deliveries, the expenditure on deliveries. And, I feel that given that 65% of deaths in India are now happening because of other kinds of diseases, and the survey also underlines the out-of-pocket expenditure for health, it increases the risk of vulnerable groups slipping into poverty. And I think NSS data, it has data on catastrophic health expenditure and out-of-pocket expenditure. So I was wondering if there is some way that can be also used as, because we are using average expenditure per delivery as one of the indicators. So if we could sort of have more indicators which reflect affordability, I think that would be great. And also, I'm not going to talk about justice because it has already been talked about. But I feel that in the current form, the index does not make any distinction between public and private provision of healthcare, education, and amenities, beyond the fact that state expenditure contributes positively to access. So I appreciate that. And high average expenditure made by people, for example, on secondary education, this is seen as an indicator of low affordability. But that is the extent to which we are looking at, the public-private dynamic in the index. And so one could, if one were to assume that a high average expenditure made by people, it's high because of the reliance on private sector, maybe that would be something, but that's not very clear. The report itself points to things. Firstly, the fact that 30% of secondary education is, secondary schools are private. This creates an affordability problem. And the report also points that urban areas rely on private sector for health services, which is linked with healthcare being less affordable than urban areas, although it is more available, but less affordable. So there is a sort of tension between availability and affordability the moment we bring the private sector in. And along with other literature, this suggests that relying on private sector for expanding availability and appropriateness may come at the cost of a lowered affordability. And if this is true, then I think maybe the AEI report needs a bit more nuanced take on the policy implications, because if the monetary and physical volume of infrastructure, health infrastructure, amenities, education, if this is what measures access, just the volume in terms of money or physical volume, and there are several indicators of availability and appropriateness which look exactly at this volume. And if affordability indicators are very few and there is no distinction between public and private provision, then in principle, states could expand access while relying solely on the private sector. There are several indicators that I could identify. For example, access to health insurance. And this was measured by households with any usual member covered by a health scheme or insurance. Availability of digital infrastructure, any individual who has accessed internet in last 3 months using any device. Approachability of education, which is secondary schools within 2 kilometers. So there are 4 or 5 indicators that I could identify, which could be, in principle, states could rely on expanding these while, completely relying on the private sector. What that does to affordability does not get captured by the index. And I know this is, I'm just talking theoretically right now, because since I haven't done this kind of an empirical exercise myself, I'm sure there are a lot of constraints, data constraints, methodological constraints, but I thought this, is a suggestion that I could, or at least this is a remark that I could share. I have 2 more remarks. One is about education, and from today's presentation as well, I understood that the reason that, we're calling the pillar education, but we are focusing on secondary education is because primary education seems to be taken care of already. But I'm curious, this is more a question. I'm curious, is there a particular reason for not including higher education beyond the fact that our society is already struggling with secondary education? Is there a reason beyond that? Because I feel that secondary education, because when we looked at the 5 indicators, that is the pillar with minimum inequality across states anyway, even though the access is not great, but the inequality is less. And I think that while secondary education is absolutely necessary to navigate society productively in today's era, with all the government benefits coming in the form of direct transfers to bank accounts, and being a part of the being integrated into the official financial system has become so important. So I feel that secondary education is absolutely essential, but higher education also plays a crucial role in creating opportunities for upward social mobility of social economic status. And in its current form, the index includes the only vocational training indicator that is included is also at the school level. So I was wondering if, because higher education, it has been already established that, upward social mobility, and that is the point of looking at access and whether or not people have access to opportunities, because we want to give everyone the opportunity to, better their lives and get to better economic outcomes. So this is just a question, is there a reason why higher education was not included? And I found a source as well. I'm not sure how useful this is, but the All India Survey of Health Education is released annually by Ministry of Education, and it contains data on several important indicators by state, gender, and social groups. So maybe, maybe data from there, if we don't make it a part of the index, maybe the data from there could help in comparing the different groups, for example, the SC, ST, OBCs versus the generals and, across genders. And the last point I wanted to make was about, because the report does contain a section on the effects of the pandemic. And the pandemic has, in fact, it has only exposed and deepened the inequalities, the existing inequalities, across the country. I feel that in the same line of thought, maybe climate change and insulation from the costs that climate change imposes is something that could be included somewhere in the analysis, if not as officially part of the index, because the rationale behind measuring access is to measure the presence of processes and institutions through which the excluded and marginalized can access upward social mobility and to move out of poverty. And the seriousness and magnitude of the negative consequences of climate change has already been established. And there is a lot of literature that links climate change to poverty, right? So, and climate change is an ongoing phenomenon that will continue. It will continue having a negative impact on poverty, and it will continue to undermine poverty eradication policies and efforts. So in absence of adequate insulation, consequences of climate change like heat waves and floods and droughts, which have become more and more frequent in India by several accounts, these sort of place costs, larger costs on the poor who are already particularly vulnerable. And these costs can come in the form of increased medical costs or loss of property, livelihood, negative impact on agricultural productivity. And also states and social groups are unequally exposed to the ravages of climate change phenomena. So if this, inequality of vulnerability or the measures to protect from these vulnerabilities, if this can be either appropriately measured, if it can be measured, then there may be reason to, in the future, maybe try and include this as part of the index, or if not, then maybe, do some other kind of an analysis which can become part of the report, because I found that the second half of the report after the AEI index rankings was discussed, the second part was also extremely useful. So in that sense, I thought this could be a contribution to the process. That's all that I have to say.
Thank you so much, Siddhi. And I'll just, before I ask Richa, just to share a few of her thoughts, and then Latika, we have some time. I must just acknowledge my gratitude to you for such detailed insights that you've offered since the time we invited you to be a part of, and over the course of the next few months, and let me say that over the next year, we will maybe bother you a lot with queries and questions. I mean, Indranil has been a victim of that, and
it would be my pleasure, Deepanshu.
So we will take it one step at a time. But
same here, Dipanshu. It's a pleasure always.
So the first point that you made, that's the only point where I just feel that, because the naming of the index has been, I mean, as the team would know, we had over a month that we have debated on this. I mean, and more than that. But month, I would say that our meetings were like, and to a certain extent, sometimes the conversation was very heated. Why we are calling this? But I borrow from what Indranil mentioned about access in its own conceptual basis being an intermediate enabler. And the question that often comes then is, intermediate enabler of what? What are you? What is the? And I think it's because maybe as an individual or as a collective or as a group of people, I'm not just talking about the educated class, and I distinguish between the educated class, the intellectual class, as Baba said did in that sense. But somewhere you would find that our tendency to think in a consequentialist frame is so normatively embedded in every thought process that we want. What is the subsequent effect or consequence of what you are trying to measure is something that overrides everything else, rather than saying, what you're trying to do. So at some point of time, you were thinking of calling it the state of access, when you're talking about state of access. But then, a lot of times the question would have come, okay, where are you talking? I mean, if this accessibility to these happen, then what? What next? What is going to help this for a certain individual or population to achieve? And so somewhere we had to embed this in a established discourse where in fact, even when you were responding to the other observations, you were saying that education for achieving a certain sense of status equality, whether it's higher education, others. So there is that tendency to link, and I think that distinction is vital, but I think we can do a better task in terms of maybe explaining that more as we go forward. But at the same point, I think there are certain times where certain silences speak louder than words, and then they are words themselves that may fall short. On the 4 A's that you have mentioned, I think that's something which we have discussed internally as well, and I think Richa, Latika would sort of bring that in about affordability and approach. Actually, the frame of these 4 A's is prevalent in the healthcare policy discourse, and we've sort of derived that in context to talking about, because Latika would remember this. I was very, very concerned that this will be a bone of contention where we'll be presenting the work on how we define access becoming an overriding, and somewhere we felt that should not sort of affect everything else that the index has done. And going forward, I think this will be brought about. Distinction between public and private, higher education, climate change, and all of these points are excellent anecdotes. I'll just say this before I pass it on to the team to respond. Our effort is that going forward, each pillar becomes an index report by itself. I'll be honest. That access to education becomes by itself like a subpart which has an independent body of work. And then there's a team of 5 or 6 people who are just working on access to education. Access to justice, we need jurists, and we also need policy level applied practitioners, or those who can look and better understand how we sort of conceptualize this. At the same time, access to healthcare, Indranil does, I think, observations that we got a very, very good sense of how we can do better. Technology is a big lacuna, which is why we have a separate panel discussion today, which looks at technology as as a separate point of looking at access to digital access. So ICRIAR's team has been very kind in helping us organize that. So with that, maybe just let me ask Richa and Latika to very quickly share their observations, and then we'll bring this to a close. Sir, in case you need to make a move, Venu sir, please proceed. I'll just keep it. Yes, sir. Yeah, please. Yeah, you're on mute, sir.
You're on the mute, sir.
Yeah. So, yeah, no, it was very heartening to see that this exercise that you've conducted. As somebody said, you need to. I'll just make one last point before leaving. You need to build civil society pressure with such research and outcomes of such research. I think it's that's very important. People should actually should know, should, even at the political level, people should see what you're doing. And this is purely just my observation. You should also engage with the various social and political groups after you finished these studies, and after you refine as you go along refining it. I think you should engage with younger members of parliament, younger people who are serious about governance. So I think you need basically try to build a coalition of people, academics, media people, young MPs, young MLAs. I think this will help your research a lot. I think at this point I'll make.
Yeah, no, and thank you, sir. And one of the instruments of that is we need your support to do that as well. And I think I must acknowledge that the Wire and Scroll both. In fact, Wire, my association has gone for like 6 to 7 years. In that sense of writing for the platform, has always encouraged a lot of the work that we've published, but we also look forward to the dissemination of the study through the platform in the ways that we can. Our own work in terms of reaching out to different stakeholders, I think that will start from the time we finish this workshop, incorporate a few suggestions, and present the findings of this. Yamini from CPR, is one person who is supposed to be here, but we will sort of also have a conversation there to present the work. The more inputs we get, the better it is. But thank you, sir, and I'll let you sort of take your time. Yeah, thank you. Richa, please.
Thank you.
Yeah.
Thank you.
Thank you, Deepanshu, and thank you all the panelists for their wonderful observation and comments. And thank you, Siddhi, for such a thorough review. I think a lot of good questions, and it does, sort of instigate us to think a little more on how we have sort of designed our indicators and sort of, in the choice of indicators that we have selected. I'll start from your last comment on, looking at the climate change and how it does affect the quality of life. I think some of the indicators that I think we could probably looking at the air quality or the water quality, and also looking at how the number of disasters in the states and UTs have sort of affected the quality of life. And I think the point well taken, and it does have effect on how some of the inequalities does persist in the states. So I think going ahead, we'll definitely bring in some of these indicators. In terms of, looking at the affordability, I would say that, as a team, we took months to sort of come out with a set of indicators, but because of the lack of data, some of the indicators that we did want to capture was how much does it, cost to actually get the justice or approach to the court, like how much does the charges involve. But given the unavailability of data, your observation is bang on that, we have very limited number of indicators that is looking at the affordability. But I think going ahead, we can definitely include one of the indicators that you pointed out, looking at the catastrophic expenditure on the catastrophic health. And I think that there is a merit in including that indicator. But obviously, we wanted to look affordability across the indicators, but because of the access, lack of data, we have, but obviously we'll also make few of the comments that we have sort of missed out in this report. Then on the looking at the secondary education and why not higher education. So as you rightly pointed out, that primary education is already taken care of in India. So we wanted to firstly look at how secondary education, how are some of the indicators performing, the states are performing in terms of the secondary education. And then probably in the year ahead, in the next year report where we design, we want to take up how the states are performing in terms of some of the indicators looking at higher education as well. But this year we wanted to just measure some of the indicator that is looking at secondary education, because I think first one step at a time. So I think primary is taken care of, and then we want to look at how states are performing at the secondary education level. So that is, I think, one of the reasons that we thought that we'll just restrict ourselves to the secondary education. Then I think in terms of the title of the paper, as Deepanshu pointed out, we have debated a lot about it, what the title of the report should be. And I think as a reader, I do understand that the title can sort of mislead or misrepresent, but I feel that the way we wanted to look at inequality was how unequal the states are, or how is the persistence of inequalities in terms of accessing these some of the amenities. And
Richa, I think we have lost you. Okay, let me just maybe ask Latika to come in and we can, yeah. Latika, do you want to go ahead? Yeah, Latika, I think maybe you can go ahead, and we'll let Richa, I think, come join back. Yeah.
Okay. Thank you so much, all the panelists, and for your valuable inputs. And adding to without breaking the continuity, adding to what Richa has already mentioned in terms of the access dimension, the core of the paper definitely is looking at the access And the findings itself, as Deepanshu mentioned, leave it to the interpretation of the reader whether there is inequality there or equality, and how the scores, depending on what is the score performance, how you put it in terms of the equality paradigm. So coming to the question where looking at the public versus private. Sorry, am I audible?
Yeah.
So looking at the public versus private comparison, so definitely when we were looking at indicators, say for example, healthcare itself, we had few indicators which included private healthcare, but since India being a welfare state, and we are looking at the responsibility of the government in providing basic amenities or basic services to the citizens. Because of that role of the government itself, we thought that we should include first and more focus on the public institutions or the government's services rather than private institutions. Private institutions also, the data is very dynamic in nature. Say, for example, the number of beds in the given in the private sector, they change rapidly. Especially in case of the COVID scenario, the private sector beds addition or deletion of the beds have been very dynamic, and taking that data itself was very difficult. So we have limited ourselves to public sector, which is more sort of stable in nature and not very responsive to the changes now and then. So it was easier to make a comparison, and even in the future versions, when we do a time series analysis or longitudinal analysis between various years indexes, it will be helpful to see the public sector growth itself, because we are targeting at the policy recommendations here. But a point definitely there is, because of we have made the commentary that because of the predominance of private sector in education and healthcare, which affects affordability a lot, it is very important to look at those indicators. And maybe in the next versions, we are open to include the private sector more as well. Then to your first comment on the out-of-pocket expenditure. So we do have the medical expenditure on the
Yeah, we're losing you, Latika.
Hello?
Yeah, sorry, we're losing you for a second.
And we have also access to health insurance, which is a major part in terms of affordability, because it is the various developed countries, it is under the ambit of the government to provide free healthcare. So that is
Okay, I'm going to circle back to Richa maybe. Richa, you had some finishing thoughts, because in the interest of time, we'll have to close in next 5 minutes as well.
No, so I was talking about the title, which I think Latika did continue, and I feel all the comments that was made by Siddhi, we would definitely, would want to incorporate in the next year report. And yeah, I don't think I have anything else to add apart from what Latika has already said. So yeah, I mean, we'll definitely, I think, reach out to Siddhi in the next year report building exercise, and I hope she won't mind sharing some of her thoughts that she already did.
I would be happy to help. Deepanshu, is it okay if I just respond very quickly to one?
Yeah. Take your time, please. We have a few minutes.
I thought there was this little bit of a misunderstanding. I wasn't trying to say that you should include the private sector indicators as well. In fact, I love the fact that you focus on the more stable ones, as you say, the more stable, the more accessible and affordable indicators, which is through the government sector. My only issue was that some of these indicators may potentially include the private sector's role as well, which could then by states be used to push up the access while coming at the cost of, lowered affordability, which will not reflect in the index because the number of affordability indicators are few. That was my point. I appreciate that you have taken state expenditure as something which contributes positively, and out-of-pocket expenditure as something that contributes negatively. Just one point on the out-of-pocket expenditure, you have included one, but I thought that was only for the deliveries, which was only for reproductive health. So I was suggesting you can possibly look at a broader measure. Sorry.
Apologies from our side, because there is an updated table of indicators. This table, which report which we had shared with you earlier, has those indicators missing, but those have.
I thought so, because I was going to say next that the report I have has 55 indicators, and today you said there are 58 indicators. So what are these extra indicators? I'm very curious. Yeah, so I'll look at the updated one.
Yes, so definitely, and I think in couple of days the updated list would be there, because those went in. It's a sort of a editorial mistake from our side. Apologies for that confusion. And I just want to add to one of the other questions which you have on why not a focus. I mean, we have very few affordability indicators. Definitely, yes, I agree on that point. But many of the indicators, though we have try to write and map them to the dimension, but many of them are overlapping. So, for example, even when you look at injustice, say, for example, why we have taken legal aid institutions, which are mainly looking at providing affordable justice at the rural or at the village level. So we can put that in the affordability, dimension as well. So that mapping itself, we've tried to do it as much possible, but definitely a point which we need to note and highlight that some of the indicators where there is overlapping, we need to mention affordability as well. Thank you so much. I hope we have addressed all your questions. And on the sustainability part, we began with the indicators which were related to climate as well. So, for example, we had access to, solid waste management services by the government picking up the waste collection, which also is an important criteria. But then because, having state level data, which, do justice to the definition of access itself, then, we had to limit ourselves and reduce the number of indicators we had. So the core, again, I would just like to mention of the report and the analysis is the axis and the dimensions of the axis which we have taken, and that is how we have chosen the indicators. Definitely we can take a lot many indicators and how we define opportunities, but it is just this one angle of opportunity which we are taking. Thank you so much.
Thank you for the very detailed and we will continue talking. So
I think that's what and Siddhi, I think on the point that you mentioned about just a clarification on the title, I think that's a point well taken. I in fact feel that we can do slightly. So just to also inform our viewers, the draft of the report that's available on the website, we mentioned it very clearly. It's a working paper in current work. In fact, the workshop for us was that stage of input for a public deliberation exercise to incorporate some of the feedback we receive. And we will update this in the next few days. On the raw data and the master file, I think that's a process which will, I feel, keep happening. There's so many back and forth, and Advaita and I think Vanshika would know. But I think this is now for us from our end. At this stage, what we wanted to do was present what we felt was in confidence, the most of what we had to write and say in terms of our findings based on what indicators were chosen. And as we go forward in conceptualizing and doing slightly better to add more details, as and when required, we will reach out to some of you individually and have consultative dialogues. But for now, I think because in the interest of time and we have another panel starting, we'll bring this to a close. I would sincerely like to thank Team Sudarshan for patiently sitting out and listening to all of us, and to Dr. Siddhi for your deeply insightful comments. And I'm so glad that we decided to reach out to you because there was, I was not sure who we could reach from within. There's so many economists on campus, but who would be a person who we could just get some thoughts from based on the work that's been produced, and to finally to Indranil for all his support and unconditionally investing that faith in us that we can periodically continue to progress. Thank you so much, and thank you. Ajay ji, we can.
Yes, sir.
We can stop the live.